Welcome to the Mindful Practice Podcast, a space for physicians navigating burnout, identity shifts, and career change without pressure or judgment. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, coach, and writer. Here we talk honestly about what it means to build a sustainable career and a life beyond medicine and survival. Welcome to the Mindful Practice Podcast. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, entrepreneur, and coach who helps physicians and other high-achieving individuals deal with burnout recovery, career clarity, and career redesign. Today, let's talk about burnout, but not in the way you're used to hearing it. Because most of the conversation around burnout focuses on symptoms, exhaustion, physical and emotional fatigue, apathy, wanting time off, headaches, GI upset. And while those things are real, they don't actually explain what's happening underneath. So what ends up happening is physicians try to treat burnout at the surface level. They take a vacation, they reduce their hours, they try to rest, and sometimes that helps temporarily. But when they come back, and the same feeling returns, and that's where the frustration builds. Because now it's not just I'm tired, it becomes why isn't this getting better? So I want to give you a practical example. So let's say we have an orange, and if we squeeze the orange, we know it will produce juice. Now, let's pretend that the orange is a physician, is you. And so when you're dealing with the constant pressures of your job, those chronic stressors are the pressure that squeezes on you, the orange, to produce juice. So, depending on the orange, it'll either produce juice that is bitter or is sweet. But that's a reflection of the orange, not the pressure. That's a reflection on what's inside of you. For example, if you are dealing with chronic stressors and that's causing you to have anxiety and depression and physical symptoms of stress, that's a reflection on what's going on inside of you. But if the same pressure is causing you to rise above, to become a leader, to become a speaker, to become an innovator, to become a systems-based learner and leader, that's a reflection of you too. So the same pressures, the same stressors can have different results, but really it depends on what's happening with you on the inside. Here's the shift that changes everything. Burnout is not always the problem. It's a signal. I'm going to say that again. Burnout is not always the problem. It's a signal. Most physicians don't start in full burnout. They start with what we talked about in previous episodes, a sense that something is off, a misalignment. They're still functioning, they're still performing, they're still meeting expectations, but internally there is a disconnect. You have less patience than you used to. Your energy drains faster. Work that used to feel meaningful now feels neutral or even heavy. And because you're still able to function, it's easy to ignore. But that's the most important time to intervene and receive help. That's the most important time to recognize these signals and decide that things need to change. Over time, that disconnect compounds, and eventually it shows up as what we label as burnout. So instead of asking, how do I recover from burnout? I want to ask you a different question. What is this trying to show me? Because burnout, when you break it down, is usually a signal of misalignment. And there are three main types of misalignment that show up in physicians: role misalignment, environment misalignment, and value misalignment. Role misalignment is when the daily work you're doing no longer fits how you want to practice. You might be still good at it. You might still perform well, but something about the work itself no longer aligns with you. For example, a physician who is excellent clinically but feels drained by high-volume patient care. They don't dislike medicine. They dislike the structure of how they're practicing it. They pace, the repetition, the lack of time to think. So they assume they're burned out. But when they transition into something more analytical, like utilization management or advisory work, they feel different. Or once they transition into something like academics, where they can teach or do research, they feel different. Or once they transition into direct patient care or concierge medicine, they feel different because there's more autonomy and freedom. They feel more engaged, more focused, less depleted. The same physician, the same skill set, but different role alignment. Now let's talk about environment misalignment. This is when the issue isn't the work, it's the system you're working in. You might enjoy patient care, but the environment creates constant friction. Leadership that doesn't support you, policies that limit your autonomy, administrative burden that outweighs meaningful work. So you end up exhausted, not because of the medicine, but because of the environment. I've seen physicians move into a different system, same type of work, different environment, and their burnout improved significantly. Not because they changed, but because the environment did. Finally, there's value misalignment. This is deeper. This is when what you're doing no longer aligns with what matters to you. Maybe you're earlier in your career and stability was the priority, but now it's flexibility or impact or autonomy. or financial growth. And if your current role doesn't align with those values, it creates internal tension, even if everything else looks fine. Let me give you an example. A physician who is stable, respected, compensated, but they feel restless. They want more ownership, more influence, more ability to shape outcomes, but their current role doesn't allow that. So they start to feel disengaged. They assume it's burnout, but it's not. It's value misalignment. Now, here's why this matters. If you don't identify the type of misalignment, you can't fix it. If you treat the role misalignment like burnout, you'll rest, but something still will feel off or misaligned. If you treat the environment misalignment like a personal issue, you'll blame yourself. If you ignore value misalignment, you'll stay in a role that no longer fits your stage in life. So, the goal is not just to say, I'm burned out. The goal is to diagnose what's underneath. And that may require some coaching, mentoring, or therapy to figure that out. But the most important thing is self-reflection and time. Now, let's make this practical. If you're listening to this and thinking, this resonates, here are some questions I want you to ask. Where exactly do I feel friction? Is it the work itself? Is it the environment I'm in? Or is it that what I value has changed? Then go one level deeper. What would the opposite look like? If it's role misalignment, what type of work would feel more aligned? If it's environment misalignment, what kind of system would support you better? If it's value misalignment, what do you actually want more of? Because once you can name it, you can start to change it. And that's pivotal. That's crucial and very important. And that's where most physicians get stuck, not because they can't change, but because they haven't defined what needs to change. Burnout is not a dead end. It is data. And when you use it correctly, it becomes the starting point for something better. If this episode is resonating with you, if you're starting to realize that what you've been calling burnout might actually be misalignment, I want you to start with the Burnout Career Reset series. It will help you break this down clearly, understand where you are, and start identifying next steps. More information is in the show notes. Until next time, take care of yourself and remember, you are not stuck. You are not broken. Thank you for listening to the Mindful Practice Podcast. If today's episode resonated with you, you can find free burnout and career clarity resources at pinnaclebusinessacademy.org. And if this podcast supported you, please consider subscribing or sharing it with a colleague who might need it. Remember, you are more than your white coat. You are not broken, and you are allowed to evolve. Until next time, take care of yourself, not just your role.